Welcome to Healthcare Tutorials by Clara, where we guide you on how to become a professional, caring, and quality healthcare provider. In this episode, we'll show you step-by-step how to take the standard blood pressure. Let's go!
First, check for proper form. Instruct your patient to sit upright with feet flat on the floor. This will ensure accuracy of the blood pressure reading. Next, obtain consent. Before moving forward with any procedure, you should first always introduce yourself and obtain consent to touch the patient. Take care to introduce yourself with your name and title. This will help the patient feel more comfortable. After that, explain the procedure. Let the patient know what to expect prior to taking their blood pressure. Finally, select their preferred arm. You should avoid using an arm that has previously held a shunt, peak line, or IV. In this instance, use the other arm. After that, locate and palpate. The brachial artery can be found in the inner elbow. Palpate this artery and inflate the cuff to retrieve the estimated blood pressure of the individual. After palpating, wrap the cuff around the patient's arm. You'll want to ensure that it is loose enough that 2 fingers can fit underneath. Inflate the cuff until the brachial artery can no longer be felt. Release the cuff. Next, inflate the cuff. After retrieving an estimated pulse, inflate the cuff to 30 mercury above the palpated pulse and wait a moment before releasing the valve slowly. Place your stethoscope over the brachial artery and take note of when the first knocking sound is heard. This is the systolic pressure and can be seen on the dial. Then, take note of when the knocking sound disappears. This is the diastolic pressure. Lastly, release and unwrap. Remember to release the valve completely and unwrap the blood pressure cuff from your patient's arm. Tell your patient what their blood pressure was. My adolescent patient's pulse was 139/80, a good, healthy pulse.
Thanks for watching. Bye-bye.